Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're going to be covering care of the patient by the PNVN. This is part 3. If you haven't watched part 1 or part 2, that's okay because it really doesn't go in any particular order. It's just a group of questions. But be sure to go back and watch part 1 and part 2 because there are lots of great information that you just really need to know if you are studying for your boards. It's also going to be helpful if you're a current nursing student as well. If you are an RN student, this information will still be helpful to you. Why? Because this is the basis, this is the foundation of what you need to know in order to answer your own questions. So this type of video is still going to be helpful to the RN student. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. Be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a one-on-one private session, a consultation session. Maybe you are studying for your boards and you need a review. You can sign up for a part 1 or part 2 review. And if you're a current nursing student, you are struggling, you need to do really, really well on your next exam, I've got audio lessons available that can help you. Again, my website is nexusnursinginstitute.com. All right, guys, without any further ado, let's get started. Here's the first question. So it says the nurse is assisting in the care of the pregnant client. The nurse obtains blood pressure reading of 160/98 and +1 protein in the client's urine. There's no evidence or documentation of seizure activity. The nurse identifies that the client is exhibiting symptoms of eclampsia, preeclampsia, preterm labor, or uterine atony. What do you guys think? Okay. And so the correct answer is preeclampsia. Why? That blood pressure is high. We have protein in the urine, but no seizure, okay? Seizure is what makes the difference between that preeclampsia and actual eclampsia. Once there's seizure activity, the patient's no longer in preeclampsia. They are in eclampsia, okay? Now, with preterm labor, this patient's not exhibiting any symptoms of preterm labor. There's no contractions, there's no cervical dilation, no effacement, no nothing. So it's not going to be preterm labor. And of course, uterine atony, there's nothing talking about, the uterus being boggy, right? What does atony mean? A means without, tony, without tone, right? The uterus being without tone, that uterus being boggy. There's no mention of this. They're talking about the hypertension and the protein in the urine with no seizure. We're talking about preeclampsia. The nurse is caring for a client who developed a stage 3 pressure ulcer due to prolonged immobility. The nurse understands that even though the client has turned and repositioned every 2 hours per protocol since hospitalization, pressure ulcers may develop from A, inadequate massaging of the affected area, B, inadequate protein intake, C, inadequate vitamin D intake, or D, low calcium levels. What do you guys think? Okay, and the correct answer, inadequate protein intake. When it comes to wound healing, pressure ulcers, patient has to have protein. Why? Protein helps with wound healing. Protein helps with wound healing. Vitamin C helps with wound healing, and calories, because calories give you energy to heal, right? So out of all of these choices, it would be inadequate protein. Now look at the other choices. A, inadequate massaging. Why in the world would you ever massage that area? The patient has a pressure ulcer. They got an ulcer from pressure. You want to know what massaging is? Applying pressure. Why would we do that? That makes absolutely no sense. So that can't be the answer. C, inadequate vitamin D intake, and D, low calcium level. So let's talk about C and D together. Calcium. Calcium is good for bone strength, right? Calcium makes the bone strong. Well, you can't absorb calcium without vitamin D. You need vitamin D for the absorption of calcium. But again, when we're talking about calcium and we're talking about vitamin D, we're talking about bones, bone strength. This is not what's happening with the patient. The patient has a pressure ulcer. And so when it comes to pressure ulcers, I want you to think of wound, and the correct answer would be protein, because again, protein helps with wound healing. The nurse is reinforcing cord care education for a young mother of a neonate. Which of the following actions would the nurse expect the mother to complete during this procedure? Select all that applies. All right, guys, if you've been following me for any amount of time, you know you treat select all that apply as true or false. So let's go. Apply antibiotic ointment to the cord daily. Clean the length of the cord with alcohol several times. Yes. Keep the diaper below the cord. Absolutely. Because we don't want anything messing with that site. And I think I'm going to remove the antibiotic ointment. I'm trying to remember. Okay, let me think. Let's keep going. Sponge bathe the infant until the cord falls off. Absolutely. We don't want to get it wet, so we're not going to bathe them. That's why they're going to get a sponge bath. Tug the cord gently as the cord dries. Absolutely not. You don't tug it at all. Wash the cord with mild soap and water. No, the whole point, the reason why we're sponge bathing the patients because we don't want to get that cord wet. So we're not going to wash it with soap and water. We're not going to gently pull on it. But yes, we're going to sponge bathe. Yes, you're going to keep the diaper below the cord because we don't want it covering the cord. We don't want it interrupting that side at all. Clean with alcohol, yes. And it helps. The alcohol also kills pathogens and it helps keep that area dry because it's drying. That ointment, no, that's false. We used to do this. We don't do that anymore. I'm removing it. Let me see what it says. Okay, good. B, C, and D. Okay, B, C, and D. Let me see what it says for A because this is I'm aging myself, guys. Ointment contraindicated unless there's signs of signs symptoms of infection. So I'm aging myself. We used to do this. We used to teach them to put, triple antibiotic ointment. And then what we learned was that it was counter-effective. So we actually don't encourage the parents to do that unless there is an active infection present. So the correct answer is you want to clean it with alcohol. Again, alcohol kills the pathogens, is drying. You're going to keep the diaper below the cord so you don't mess with that area at all. And you're going to sponge bathe the patient so that area doesn't get wet. Okay. So a 70-year-old female is admitted to the medical surgical unit with a diagnosis of CHF. The patient has a history of hypertension and diabetes. She is also an active member of her local church and draws great strength from her religious beliefs. She often prays and seeks spiritual guidance in times of illness. Here's the nurse's note. Upon admission, the patient appears fatigued and expresses concerns about her health. The patient mentions that faith plays a significant role in her life and she believes in the healing power of prayer. The patient requests that a chaplain from the church be informed about her admission and wishes to have moments of prayer during her hospital stay. Vital signs are stable, no signs of acute distress, initiating of plan of care with a focus on religious and spiritual influences on health. As a practical nurse assigned to this patient, you're tasked with addressing her religious and spiritual needs related to her CHF diagnosis. Answer the following question. Click to indicate whether the nursing interventions listed do or do not align with addressing the patient's religious and spiritual influences on health. Okay. So we're focusing on the religious and spiritual influences on health. All right, let's go. Requesting a visit from the hospital chaplain to provide spiritual support. Yes, that aligns. Facilitating moments of prayer and meditation as requested. Yes, allow them to pray or meditate. Providing educational materials on the role of religion and spirituality in promoting health. Yes. And that's always something you want to do, is to educate your patient. Absolutely. Collaborating with healthcare team to incorporate spiritual aspects into the plan of care. Yes, you want to respect their religion and their needs. Recommending alternative therapies solely based on spiritual needs. No. Let me tell you why I'm saying no. This word solely. This word solely has completely changed this question, because if it said recommending alternative therapies based on spiritual needs, actually that would align. That word solely, you know what solely, and I tell my students this all the time. If English is not your first language, you need to Google these synonyms, because in the English language, you have 800 words that can mean the same thing. That word solely is an all-inclusive word that I tell you to stay away from all the time. Solely is another word for only. Stay away from solely, only, never, always. No, stay away from them. All right. Anyway, let me check the answer. Okay. So all of them align except for the last one. And I'm telling you, if you remove that word solely and kept that sentence, it would align. But because it said solely, only, we had to get rid of it. All right. The nurse is assisting in the discharge of a new mother and her newborn. The nurse notes that the newborn should travel home from the hospital in A, front seat in rear facing infant car seat, B, front seat in forward facing infant car seat, C, back seat in rear facing infant car seat, or D, back seat in forward facing infant car seat. What do you guys think? C. First of all, you should have gotten rid of the first two automatically, because you know they're not sitting in the front until they're big, big kids, right? So you know they're going to be in the back, and it's an infant. So not only are they going to be in the back, this is an infant, they're going to be facing towards the back. So they're going to be in the back seat, rear facing. The home health nurse is completing a follow-up visit for a client diagnosed with AIDS. Which behavior, if observed by the nurse, indicates the need for further instruction? A, the client uses the same razor as other family members. B, the client uses the same dishes and utensils as the rest of the family. C, the client uses the same bathroom as the rest of the family. D, the client cooks meals regularly for the family. A. This patient has an infectious disease that is transmitted through bodily secretion, so they should not be sharing razors with anyone else. Okay. A client brings her 9-month-old who has a high fever to the emergency room. Which action should the nurse suggest to the mother to promote the infant's comfort during the exam? A, continue to hold the infant. B, not offering the infant a pacifier. C, giving the infant to the nurse. D, placing the infant on the exam table. And the point of this question, we want to promote the infant's comfort. So the correct answer is continue to hold the infant. Here's the thing, when it comes to peds, and you're doing an assessment, you want to do, first of all, the assessment from least invasive to most invasive. So you're going to like listen to the heart and the lungs first before you stick anything in their mouth or their ear, right? And you want to do as much of the assessment as possible with that patient comfortable sitting on the parent's lap, because that's who they trust. They're fearful of you, the nurse, right? So you look at this answer, not offering a pacifier to the infant. Why would you not offer a pacifier? A pacifier is comforting to the infant, because remember, in the infancy stage, where does the infant get their joy from? Orally, right? From sucking. So that pacifier will comfort the infant. C, not giving the giving the infant to the nurse. No, giving the infant to the nurse is going to increase that infant's anxiety. The infant does not know you. They don't feel safe with you. They feel safe with the caregiver. And then D, placing the infant on the exam table. You really want that infant to start screaming? Go ahead and do that, right? The best thing to do is allow the parent to hold the infant. So while the infant is feeling secure, you can examine the infant. And again, you're always going to go from least invasive to most invasive. The nurse is reinforcing with a 16-year-old male client how to use crutches. What is the first step the nurse should observe when the client is getting out of a chair from a seated position to maintain proper balance? A, the client will push down on the crutches and chair armrest to pull himself into a standing position. B, the client will move to the edge of the chair and place his hands on the handbars and pull himself up. C, the client will move forward to the edge of the chair and place the unaffected leg at the edge of the chair. D, the client will transfer his body weight to the crutches and push up with hands, and then use the crutches? What do you guys think? So what you expect them to do, first of all, do you understand it takes much more energy to push energy and your weight to push yourself up if you're sitting in the back of the chair? Do you understand that? So what you expect for them to do is go ahead and scoop themselves up to the front of the chair, right? So it's going to be easier, much easier when they stand up, and they're going to be bearing their weight not on their hands, on the leg. That's why you put the unaffected leg, the leg that has no issue. That's why you put that down, because that's what they're going to use when they're going to be standing up. Of course, their arms are going to support them, but that weight is going to be on the unaffected leg, and that's why you have that forward, okay? The nurses The nurse is participating in the care of a client scheduled for an elective cardioversion. Before the procedure is attempted, the nurse correctly holds which of the following medications? Warfarin, digoxin, heparin, or diazepam? Which one would you hold? Which one are you? Okay, yeah, this one. Okay, so let's talk about this. So the patient's getting cardioversion. So imagine you got a patient, they've got AFib, and now they're going to have cardioversion. Cardioversion is when that patient has an arrhythmia and either electricity or drugs is being used to change that arrhythmia back to like a normal rhythm, right? So think about it. Why would we hold warfarin or heparin? This patient has a dysrhythmia, and usually it's going to be AFib, right? So they're going to be at risk for clots. We don't want this patient to throw a clot, because the last thing we want to happen is for that clot to get dislodged, where it's going to go straight to their brain and the patient's going to have a stroke, right? So we're not going to hold that warfarin or the heparin, okay? That patient's going to be on anticoagulants. I promise you that. We're not going to hold that. And diazepam, let me tell you why that would be needed. Diazepam, Valium, it works as a sedative during this, it has like a sedative effect during this procedure. So we're not going to withhold that. What we are going to withhold is digoxin. Think about this. Digoxin, we love digoxin. Patient has CHF. We give them digoxin, increases contractility of the heart. Great. What else does it do? Slow down the heart rate. This patient's getting cardioversion. Is this the type of med we really want them to be on? Absolutely not. So we're going to hold digoxin. And also, if the patient's on diuretics, you're going to hold diuretics as well. If they're getting cardioversion, you're going to hold the digoxin and diuretics, but you want them to get their anticoagulants, and you definitely want them to get something that has a sedative effect for this procedure. All right, last question. The nurse performs a Weber test on the client who presents to the community clinic complaining of difficulty hearing. The nurse correctly identifies which of the following locations to place the tuning fork to perform the Weber test. This question, guys, you see it for PNVN, but you're also going to see this question for RN. And guess what? You're also going to see this question for APRN, Advanced Practice Nurse Practitioner. You're going to see this. So you might as well learn this now, because if you plan on being a nurse practitioner and you go up those ranks, you're going to see it again and again. So, all right. So where would you place that tuning fork? Site 1, Site 2, Site 3, Site 4. Let me look at the sites. Okay. This is, okay, 3. 3. Right here in the middle. And so what happened, you strike that tuning fork first, and then you place it right here in the middle of their head. And then what you're trying to do is test their hearing to see if they have decreased hearing in one or both ears. But, well, not both, but in one of the ears. You want to see if hearing is better in one than the other. Okay. So you're going to place it right here in the middle of the head in Site 3, right here, guys. Right here. All right, so guys, that's the end of this video, because I'm trying to make these videos 10 questions each so that they're not too long, easy to follow along. This is a new series. This is the third part of the series. So please Help me, any constructive criticism, but be kind. Let me know in the comment section what you think about this video. If there's anything you think I should add or change, please let me know in the comment section. Please don't forget to like or well, not and like and subscribe. Like this video, but also subscribe to my channel. Turn your notifications on so every time a new video is released, you'll be notified. Guys, don't forget, I'm gone during the summer. June, July, August, I'm traveling with my family. That's just my time. That's my time. So I'm letting you guys know now. If you guys get a video out of me, you're gonna be lucky because I take 3 months off. But I'm gonna try to see if I can at least, release one video a week. But it's not promised. So make sure if you are taking courses during the summer, you're studying, you're watching my old videos, and I'll be back in September. But until the end of this month, I'm going to try to push out as many videos as I can for you since I know I'm going to be gone for a little while. So guys, thank you for watching this video, and you guys will catch me on the next video.